Welcome to Next to Madison, a podcast to help you live your best life. Hey, and welcome back to another episode of Next to Madison. I am your host, Madison Malloy, and I'm excited today. We are discussing mental health, and my guest that's going to be speaking about this is a psychiatrist based in San Antonio, Texas. And she's going to kind of go through the different things of mental health and when to go to an office, when to get medication, maybe how to reduce stigmas, things of that sort. Mental health is so important, especially during this time now where people are experiencing more mental health issues just due to what's going on with lack of work and the fear in the media and things of that sort. So with that being said, I would like to bring on my guest with me today, psychiatrist, Dr. Melissa Deuter. How are you?
Hi, thank you. I'm glad to be here.
Yeah, I'm so glad to have you. So tell us about yourself. Give us a little bit of a background on you.
Sure. So I'm a psychiatrist. I'm in San Antonio, Texas, and I own and operate a clinic here that is a walk-in mental health clinic. So we offer immediate services to people so they don't end up waiting. And that kind of evolved. I was initially in private practice and just seeing patients on, a wait list basis, and people could call and set up an appointment with me. And then the wait times in my community and really nationwide got longer and longer. And I started to feel like turning people away or making them wait for months. In some cases, 2 months is pretty common here, and probably in some places around the country, it can be as long as 6 months. I decided that really didn't feel like being helpful. And so I transformed my practice into a walk-in clinic where I have a team here and folks can get immediate help. So that's what I do here.
Which is so great, because that is the thing, is when people need help. I mean, I always said, it's easier to get a gun in this country than it is to get mental health help.
It really is. The wait time is really absurd. And I think that, one of the things that I'll just jump right in and talk about that I think is so important about that is that waiting makes things worse. There's a lot of data on this, and it's a known factor for many mental illnesses that if you let it get very severe, then the long-term course of it is worse. And so it really, that immediate contact when a crisis is happening is one of the most important things that we can do to improve long-term outcomes. And so when, somebody's calling my office and I'm saying, oh, sure, I can help you, but it's going to be 6 weeks or 8 weeks, it really didn't feel like I was serving the mission of being, a resource to my community.
Right. Well, that's exactly right. Because usually what happens is you don't set up counseling or any other type of mental health kind of help until it's almost too late.
Right. And some things happen very quickly. There are a lot of folks who, maybe they are getting a divorce, or they lost a job, or family members passed away. Something has happened and their symptoms have gone from something manageable to something very unmanageable rapidly. And so that's an important piece as well, is that, we think, well, people with mental health conditions, those are long-term and they build into those and they have brain diseases. But in some cases, that's simply not the case. People go through stressful periods, and maybe some pre-existing problem with anxiety then blossoms into a bigger problem in a crisis. And that's much more common.
Right. Because it's always, especially now with so many people out of work, it's, when people are employed and they're busy and they don't really have time to kind of think too much or sit too much and kind of have their brain play tricks on them. And then all of a sudden something happens and it's just a major shift that can be derailing. And the thing they're not talking about now, all we hear about is like the COVID cases and the COVID deaths. But what we're not hearing about is that there has been a major increase in suicide.
So those numbers are coming in. It's interesting. In my community, one of the things that's been difficult is some of the ways we track suicide are a lot of those resources and those monitors have been pushed by the wayside, or they're being done differently. Offices are closed. Public health officials are working from home and don't have access. And so that it's been an open question as well. I mean, I think intuitively people have said, clearly this is not going to be good for mental health. Job loss, economic decline, a mass death event throughout our country and the world all at once. This has got to be bad for people, but we're also having some trouble monitoring specifically and being certain about what's happening. So that's created a little bit of confusion. But we do know what I'm seeing, and I think people on my team, this has been their experience as well, is we're seeing people who are actually waiting too long. So the pandemic started, our community shut down, and we went to telehealth immediately, very, very quickly. We just were able to quickly, turn over and start doing telehealth. And a lot of our patients who had planned to come in canceled their appointments and said, I'm going to see what happens. I need to know what's going to happen with my family, my job. I don't know how to use telehealth. This is all new. Let me just see if I wait a few weeks, if I can come to the office. And it was very clear to me that they probably weren't going to be able to come to the office. So we waited. And then many of those people showed up weeks later in much more severe circumstances than they would have if they'd kept their original planned appointment. And I think that's probably what's happening nationwide. People waiting to get the help they need because they're hoping for better times.
Well, yeah, and just kind of saving as much money as they possibly can.
Saving money, saving resources, and like I said, having a little bit of anxiety about going into this telehealth world, which was new for many folks. And it has been seamless. Across medicine, people are using telemedicine now, which is great. It's a good resource that had been used to, it had been used maybe incorrectly to staff, city hospitals in the middle of the night rather than bringing in a doctor, for example. So you see somebody on a screen, that had been happening. But now it's this convenience issue of, hey, I don't have to drive to the office, or, everybody's kind of learned to use it and it's been onboarded. And that's been really, really helpful, especially to mental health. But a lot of people, that's been their final checkpoint, is they're concerned about going into the telehealth world for their mental health, and they have some anxiety about making that transition. So
yeah, well, because it's new. I mean, anything that you kind of introduce that's new and they're not used to it, and but it is definitely important to see that kind of face to face.
right.
So at least like it's the computer and things of that sort. So what I always had, I feel like a lot of people don't get the proper mental health that they need care because of insurance. Why do you think that a lot of insurance companies don't necessarily cover mental health?
Yeah, that's a great question. I think that insurance companies tend to, well, first of all, their primary job as insurers is not to improve health. Their primary job is to make money for their shareholders. And I think that that's a problem when you bring that in. There are a lot of ways that turning healthcare into big business has created a lot of problems, because there are a lot of folks trying to make a profit off of something that really doesn't or shouldn't have these wide profit margins. But that's a whole nother issue. So the problem with mental health is that in general, there's a belief, I think, that if people go in and they start counseling, or they start going in for mental health visits, that they will overutilize possibly unnecessary services, and it will become expensive. And I think it's in, the short-term cost saving measure for the insurance companies who are trying to earn a buck or whatever, they kind of say, well, if I let this person go to weekly counseling and we pay for that, and we let person after person do that, it's going to get really expensive. I think the truth is that if you give people access to the services they actually need, that you would cut overall healthcare costs. There are folks who have, for example, I mean, one of the things that I think is really interesting and common if you talk to primary care doctors is there are a lot of people with health-related anxiety, and they'll go to their primary care doctor and overutilize services trying to get answers to questions that are really about their fear of having a disease and not necessarily about their actual physical ailments. And if you offer that person the correct resource of mental health help, then you can actually cut cost by, solving the actual problem. But I think that the insurance companies are really just trying to save money in the short term without really being able to see that bigger picture over the long term.
Right, exactly. They're short-term thinking and not long-term. That, you're absolutely right. It could, cut costs. So let's talk about anxiety, because I think a lot of people kind of have it. What would you say from dealing, or, being an expert in this field, are some ways if somebody's feeling anxious that they can kind of help turn that voice off in their head? Like, what are
Sure.
at-home kind of things that you'd recommend?
Sure. And there's so much. I mean, this is one of the beautiful things about the internet. And, there are podcasts and there are blogs and there's so many places you can go out and look for ways to take better care of yourself. And just a few things I would tell somebody about anxiety. I mean, first of all, everybody has anxiety.
Yep.
Anxiety is a thing that we all live with. And then there are times and there are individuals for whom that becomes over and above normal or manageable, right? And so we all have stress, we all have fears, we have worries, and there's good data. I think it's important to follow the data on this. And in terms of management of anxiety, the very first thing that people need to do is take care of their basic needs and learn to deal with their feelings and not avoid them. And so the basic needs part would be eat well, get plenty of sleep, exercise, drink water, right? Manage your lifestyle choices and the things that make your body feel healthy and vibrant at a baseline. Get that vitamin D, right? Go out and take a walk in nature, all of those things. And then beyond that, there's a lot of data coming in about the practice of the daily tools of mindfulness, which is sort of just noticing experience and not necessarily reacting to experience. Deep breathing, the kinds of things that, again, all those podcasts and those blogs teach you about anxiety management are really true. Just sort of lowering your stress and getting present in the moment and out of your churning, worrying mind.
Yes, absolutely. And so what do you think about zinc? Because zinc is something that I feel has helped me with my, if I was feeling depressed or anxious or down. I took a mild dose of Prozac for a while, and it kind of numbed me. And I thought, well, why am I taking this if I'm really just kind of feeling this way around my menstrual cycle? So I started taking zinc and completely got off the other thing, and it's really helped me.
Yeah.
And when I'm deficient in it, I start to feel a little down and blue.
Right. So I guess there were layers to the question. I'll start with on the issue of zinc itself. I mean, it's one of those self-care issues, right? If you have these minerals in your body and these various chemicals and substances that help your body run normally, and you become deficient because you're, eating Cheetos and drinking Diet Coke or whatever, it's important to put your body back in balance. And while, vitamins and supplements and so forth are not necessarily always treatments for disease, right? They can be, but keeping your body in balance is really important. So for some people, if that means that you need to take zinc or you need to get that vitamin D or calcium or whatever it is, it's important to do that so your body can run well. One of the theories and that's supported by a lot of research about depression, for example, is that inflammation in the body, the presence of sickness, can lead to depression. And so if you keep your body healthy, then you're less likely to have those symptoms. But I do think that there are also people who need Prozac, right? And there are times, there are eras, and so there might be a person who exercises daily, they take a really great multivitamin, they, eat their greens and their healthy, nutritious meals, and then they go through a period of time where that's simply not enough. And I think for that person, turning to the benefits of the science of medical treatment should also not be stigmatized, right?
Yeah.
Because it's certainly good to take care of yourself. I want people to do that. But if you're doing everything and it's not working, then there's this other layer. And probably for a person like yourself who takes the medication and feels numb, that may be because the medication was over and above what you needed, right? And so if a person is in emotional pain and that medication comes in and treats a disease level of depression for that person, it's probably welcomed. The body's better with it. But if a person is generally pretty well and they can practice that good self-care, then the medication feels like taking too much medicine, right? And so that's really maybe the difference, is that I think psychiatry's gone to talking about this over the last, decade and a half, this idea that it's kind of a scale from low to high, right? There's normal sadness or normal anxiety, and then there's maybe a stress induced kind of a bigger issue. So for sadness, that might be grief, that you have a sense of loss or change, or even bigger, the loss of something substantial, a marriage, the death of a loved one. And then beyond that, there are these states that are much more where a person is stuck in that deep level of a sense of emptiness or sadness that's far more than their life situation would dictate. And they're not able to get it back together because something's really going wrong biologically with their body. And that person on that extreme probably really does need a medical intervention. Whereas the person who's having a routine stress-induced sadness, or a normal sadness, I mean, it doesn't even have to be stress. We have good days and bad days and ups and downs. That person can maybe go do a quick workout and call a friend. And I think we need to see that there's a difference between normal sadness and depression. And, we need to intervene on the worst cases and not the mildest cases. We need to be able to sort of distinguish those differences and help people according to where they are on that scale.
Yeah. So how do you determine when somebody needs a medication and what type of medication is right for them?
Right. So I mean, years of training would be the first thing I'd say, right? So I'm a psychiatrist. I'm a medical doctor. I went to medical school,
Uh-huh.
and then I did 4 years of psychiatry residency, right? So there's this long journey of first an undergraduate degree for me in biology, and then 4 years of medical school where I'm assisting in gallbladder surgeries and helping deliver babies and really understanding the workings of the entire body. And then 4 years of psychiatry residency where I'm only treating mental health conditions and really focusing on those medical and psychological pieces. And I think the psychiatrist is sort of the quarterback of the mental health team, right? So this is that I might be the person who does the assessment, and I say, Madison, I'm hearing you, and I don't think that you have a mental illness. I think you have a stress-induced period of time, or you're having issues with your hormones. I think the first thing you should try is to go talk to this counseling professional and maybe get back to your workout routine that you're telling me was so healthy for you. And that might be enough. And another individual, or you at a different time, I might come in and say, okay, I think you've tried to do all the things you can do, and this has really gone beyond what you're able to manage on your own. And I think we need to talk about other treatments.
Right. So there's so many drugs on the market. How do you kind of know which one to pick? Or
Yeah. And again, gosh, years of training and experience. And there are primary care professionals like family doctors, internal medicine doctors who treat people's general needs and often kind of reach for their favorite routine medicine or maybe what they have in samples for people. As a psychiatrist, I see so many nuances of people's, personality, maybe issues about how they're holding their emotions, their baseline personality traits, that they're like, I'll give you an example. Somebody comes in and they're having a depression, and that person A is
Mhm.
a naturally anxious individual who has always had some anxiety lifelong since they were a child, versus person B, who's never been an anxious person, and they've been somebody who was always pretty happy, and now they're down and low, and their energy's low, and they've really never experienced that before. There are differences and nuances in how medications work. So for the person with the anxiety problem that's been lifelong, I'd be thinking about what that means about the biology of their body, and probably choosing antidepressant treatment for them that might manage some anxiety and certainly wouldn't make anxiety worse. But for the second person, I really wouldn't be careful to choose a medication that covers anxiety, or is careful not to cause a worsening of anxiety, because that's not a problem they have. So it's really about the nuances of understanding how the body works and how the medications work within the body, if that makes sense.
Okay. And so can you kind of, what are the differences between some of the medications? Like you hear about Prozac, you hear about Zoloft,
Mm.
um, and then you hear about Xanax, and then Klonopin. What are kind of those differences between those medications?
Yeah. Gosh, it's such a big question, because right now, if I were to pull up a list of like actively prescribed mental health related medicines, there'd be hundreds.
Yeah.
Okay, there'd be hundreds for lots of different conditions. We're talking about depression and anxiety, but there's also bipolar disorder and schizophrenia and panic attacks and OCDs and eating disorders, and there's so many things that fall under the category of mental health. The ones that you're asking about, Prozac and Zoloft, are SSRIs. They're selective serotonin reuptake inhibitors. And what that means is that in people with anxiety and depression, and those medications are used for both anxiety and depression, people have some issues with the flow of neurotransmitters through the system, and the neurotransmitters being in the right places. Okay, and those medications sort of open a gate and let neurotransmitters flow to where they need to be, and in that way seem to manage illness in those folks. But Xanax and Klonopin, those are very, very different things. And some people, I think, don't understand that. So Xanax and Klonopin, those are benzodiazepines. And those are medicines that are used often for very short-term management of anxiety. For example, when a person is getting a medical procedure and that person is having acute anxiety, and you're treating them so that they can calm down right now, today. The difference that I think is important is the Xanax and Klonopin medicines, first of all, are addictive medicines. It's important to realize that. And those are used for very short term. And if prescribed or taken for long-term use, they'll lose their power and stop working as well, which makes them not a great choice for long-term treatment for anxiety, or definitely for depression, which they really don't do at all. And I think people hear these names and they don't know. This is where I think it's important to understand, to work with a healthcare professional and ask those questions. Is this a medicine that's going to stop working? Is this a medicine that's going to lose its power? Or is this something that might manage my symptoms long term and help me with this for 6 months or a year? Or is this something that's really only going to work for a couple of weeks?
Right. So so if somebody's is prescribed a Xanax by their health professional, how long should they be taking it before or is it just when they feel just anxious?
Right. Yeah, the medical profession over the last several years has gotten further and further away from recommending the use of medicines like Xanax, which is, I'll use Xanax because people have often heard that name. It's the generic name for it is alprazolam, and but people have heard of Xanax, and in general, people know that Xanax is used for mental health, And they probably know that it's used for anxiety, although not everybody knows that, and that it's addictive. Those are things that people sort of know. Um, as the opiate epidemic has come to light, and it became clear that people were in danger from the use of prescription medicines, Xanax-like medicines have been caught up in that examination, and it turns out they contribute at a high level to overdose deaths.
Oh my
They
God.
also contribute to the development of Alzheimer's disease long term, and they also stop working. So the medical profession is moving further and further away from using those as primary treatments long term. And it had been, I mean, it's an interesting, like a side note, just sort of candidly for me, is I was in medical school and I'm learning about pharmacology, and they're saying, you know, this is the way this medicine works and this is what it does. Okay, you know, I understand. This is what a Xanax does. And then I went out into practice and I saw that it was quite common to prescribe those medicines day in and day out for people for many years. And I was really confused about why that would happen, because based on the pharmacology of the medicine, it's not a great way to use it, because it will lose quite a bit of its power. And then what will happen is the person's sort of stuck on the medicine. It's not working very well. And sometimes when I talk to patients, they're afraid I'm saying, you know, oh, it's addictive, you're going to misuse it. No, it's going to mistreat you. It's unreliable. You're going to start a treatment that is going to become unreliable over time and is not going to sustain your wellness. And so as that's all become clearer and been discussed more, medical professionals are really moving toward not leaning into those medicines so much, and really trying to move toward things that you know, don't stop working, frankly.
Right. No, absolutely. So that's interesting that you brought up the point of Xanax contributing to Alzheimer's. I mean, do you
Right.
think that they're eventually going to pull it off the market?
I don't think that they'll pull that or other medicines like it off the market. They're really important for a number of uses, including in hospital uses. Okay.
Okay.
When people are, for example, you know, after a person's had a major surgery, sometimes they get very restless and confused. And that immediate intervention of a medicine like that is very important for hospital care, sometimes emergency room care. There are important uses for it. But I think overall, it's really not going to be favored as an everyday take-home kind of treatment strategy in the way it was 5 years ago. And the data on Alzheimer's disease has come out in the last, you know, 5 years or so, and where we said, aha, right? If you put the brain in kind of a sleepy, lulled state with a sedative day in and day out, then the brain is not going to be sharp and it's not going to be quick in the way it was, and you're going to contribute to the decline of, you know, memory and other brain functions. It makes sense.
No, it absolutely does. I mean, do you feel that our society is overprescribed?
Oh, sure. Sure. If you look at, um, you know, around the world, the rates of mental health conditions are pretty steady in all kinds of different cultures. But in many places, there's not such a quick reach for the prescription medication. And other things are recommended, including counseling support, family support, lots of other, you know, spiritual interventions for people. There might be some consultation with their spiritual leaders or whatever it is. And I think in the westernized medicine, there's that immediate, hey, I'm sad, I'm down, I have a loss, I'm struggling, and we go straight for the prescription pad, which I think we're really not serving the best interests of our communities by doing that.
Right, because they can become addictive, you know, and it's hard.
And even still, I think it's not. You know, one of the things that I have a real interest in, that I end up talking about is the message we're giving people, that, you know, if your parent dies and you come to me and I'm your primary care doctor and you're crying in my office, And the first thing I do is diagnose you with depression and give you a prescription. In some ways, I'm treating you as if this response is not normal. And in fact, if your parent dies, it's quite normal for you to be crying in your primary care doctor's office. Now, granted, there are people whose parent dies and they do need medical support to get through it, but many, many people don't. It shouldn't be our first thing that we jump into medicalizing human distress and emotion, because it does some harm to you. If I say, yeah, you know, it's abnormal that, you know, your parent died and it's been 3 weeks and you're crying. It's not abnormal at all. And I think it's uncompassionate and inhumane for me to act as if it's abnormal.
Right. No, that makes sense. So what is the difference so people know between a psychologist and a psychiatrist or a therapist?
Right. So a psychologist, so I'm a psychiatrist.
Uh-huh.
A psychologist studies the theory and practice of the mind
Okay.
in a PhD program, right? So their doctorate is a doctorate of philosophy or education in some cases, or but not medicine. And so the difference is a counselor or a psychologist, and counselors can be at different levels, don't go to medical school. They study the mind only. Psychiatrists like myself go to medical school and then specialize in mental health as their primary specialty, as opposed to obstetrics or pediatrics or surgery.
Okay. And then what about a therapist?
Yeah. So a therapist, and again, there's so many different kinds. It's almost difficult to explain. And I know this is hard, right, for the public, because so many therapists have a master's level training. They're either a licensed professional counselor or a licensed clinical social work counselor, something like that. And they have a master's degree. So they went to 4 years of college and then a master's degree, which is roughly 2 more years, give or take.
Okay.
A psychologist usually has a doctorate in something related to the mind or in psychology, and so they have a PhD, which is a longer, more in-depth degree than a master's level, but they may be performing some of the same functions or some different functions. A licensed professional counselor might meet with people and help them cope with stress, help them deal with their emotions, practice exercises for coping with anxiety, calming down, talking about your feelings, marriage counseling, etc. A psychologist might do those same things, but also psychologists do more psychological testing, where they might do ink blot tests and get to deeper truths and serve as expert witnesses in legal cases and do some other more, I guess, academic and studied roles.
Okay. So when would somebody know if they're struggling with something and they just can't break it? How do they know who to call? Do they call a therapist or do they call a psychiatrist?
Right. This is a wonderful question. I'm glad you asked me that question.
Okay.
So this is a little bit funny. I'm a doctor, but
Yes.
I think people should call a therapist,
Okay.
because if you go to a carpenter, they're going to pull out their hammer and their nails. And if you go to a medical doctor, a prescribing clinical person, they're going to reach for medicine. And I think medicine should come second. Okay. The
Okay.
first thing that should happen if I'm struggling with my emotions, the first layer is that I should try to understand and sit with those emotions and get some advice about how to take better care of myself, communicate, resolve conflicts, all those kinds of natural things. And unless that fails, or my problem is already very big, after the self-care and the talking and the understanding fails, or if I haven't slept in 3 days and I'm hearing voices, right, then I need a medical professional. If I'm having something bigger than the kinds of things that people go through on bad days, and it appears to be more of a medical condition. But the first layer, when I'm having feelings and I'm having stress and I'm having struggle, is to go see a counselor. And
Okay.
that counselor can make a referral if more is needed.
Okay. So when somebody comes to your office, how, like, what's a typical meeting with a psychiatrist? If somebody's thinking, okay,
Yeah.
I'm a psychiatrist, I need to be on something, do you sit them down in the first couple meetings or kind of talking about your feelings so you can understand them? Or if they go to a psychiatrist, does that mean they're leaving with a prescription that day?
Yeah, so I guess in some ways that depends on the psychiatrist. It doesn't necessarily mean that in my clinic. The first thing we do throughout medicine is we take a full history. There's a protocol for that you learn as a medical student. That includes why you're going on with you that's led up to the visit, but also your personal medical history, your family medical history, your family psychiatric history. Have you used drugs? Are you using alcohol? Do you smoke? All the kind of deep background. And then we take that all together with the current symptoms and try to come to at least a theoretical medical understanding of the person's problem and make recommendations accordingly. So if you came to me in the example I gave and you were dealing with heavy grief and you were 3 weeks in, my diagnosis would be grief, and I probably would not recommend a medication. But if you came to me and you were hearing voices and that had been going on for 3 weeks, I probably would recommend a medication for that to try to stabilize it as quickly as possible. So it really depend on what kinds of issues we were looking at and what diagnosis I believed clinically underlies the problem that you're having.
Okay, no, that's very well said. So what you mentioned some substances like nicotine and alcohol. Do you feel that those play a major role in depression?
Yeah, so I won't say that I feel, I'll say research suggests.
Okay.
I did a continuing an event where they were encouraging patients to quit smoking, and they found that in patients with depression,
Uh-huh.
okay, who were smokers, if you took two separate groups and in one group of depressed smokers gave them an antidepressant, and in the second group worked with them to quit smoking with no antidepressant, the quit smoking group also improved with their depression, in some cases more so than the antidepressant group. So there's data that even smoking, but certainly we've known for a long time drinking alcohol contributes to mental health issues. And so really that comes back to optimal wellness, right? If your body is not happy, you can develop all kinds of physical symptoms, including mental health related symptoms, which can be very biologic and driven by the unhealthy state of your body. And so addressing that can be an alternative to having mental health treatment in some cases. And then of course, marijuana, cocaine, right? Opiates, there are all kinds of substances that can affect mental health at different levels. Some acutely, if a person's under the influence of drugs, they can come in and look like they have a mental health condition, but actually be, suffering under acute intoxication or withdrawal from substances. So all of that becomes important in making an assessment.
Right. No, because I think that's a fascinating thing, because you think about it, maybe if you're feeling depressed or you want to go and get meds, maybe the first thing to do is to look at the substances that you're putting in your body to see
Absolutely.
if those, because, especially you were saying a study with nicotine that quitting smoking actually worked better than the antidepressants for these people, which is really amazing. That
It is amazing.
yeah, because it's like obviously this chemical or drug that's in it, nicotine, is causing the brain to not fire those SSRIs, correct?
Yeah, and maybe even more complicated than that, but something, there are layers of biochemistry that we're altering when we're putting these addictive substances into the body, and rebalancing and getting back to the natural state of the body is an important piece in your health overall. It's important for your blood pressure. It's important,
Yeah.
for your heart health, and all of your systems, including your sense of well-being, joy, happiness, peace, and all of that. It all really goes together.
Yeah, absolutely. And so what do you feel about like practices like yoga that are so great that really focus on like the breath work and putting your mind into the present? Is that something you think that just everybody should be doing?
Yeah, and again, I would say that my personal opinion is probably less important than data, because if you look at my opinion would limit me to the few hundred cases I had personally seen. But if you look at the data on all kinds of practices of mindfulness, and that includes yoga, that includes meditation, they improve well-being. They Those practices lower stress and improve overall mental wellness when practiced on the front end. And I do think there's a nuance here that's really important, though, that if somebody is suffering in that far down the line, like I was saying, this scale, high degree of depression, they probably can't hop up and go do some yoga. They need more help. Something bigger is happening. But for the everyday person on the street, if you want to know what you can do to feel better and really keep yourself out of depression, out of a crisis of anxiety, take care of yourself, eat well, exercise, do the deep breathing, practice mindfulness in some form, if that's yoga, if that's meditation, if that's both. Those are all the kinds of things you can do to stay well, and they work for most people.
Yeah, no, that's great advice. So what do you think is more effective, an in-office visit or a medication? Like where do you feel,
Hmm.
because some people will get this medication and then they'll just keep taking it as prescribed, but maybe they stop coming into the office.
Right. There has been a lot of research on the therapeutic relationship between a mental health professional and patient.
Uh-huh.
And it is very important. So medication does some of the lifting, and the treatment relationship does some of the lifting, and the two can work together. And I guess it depends, right? Some problems are highly biologic, and once stable, the medication is necessary and sufficient. But many problems require some human connection, especially when they involve the mind and the emotions. And so, it's case by case, but in general, that trusting relationship with a person who cares and understands is a big piece of the puzzle for people's mental health.
Yeah, absolutely. And we're hearing more about mental health and kind of raising the awareness and removing the stigma from it. Do you think as more conversations continue happening that people will have easier access to behavioral health or mental health?
I think so, but there is a little bit of a problem as we raise these conversations with an over focus. One of the things that just sort of makes my skin crawl a little bit is to hear a group of adolescents saying, "Oh my gosh, I had a panic attack," whenever that person looked at me. And by bringing it into the public conversation, we might be over identifying. I hope that that's on our path to normalizing, right? Because normal anxiety is not a panic attack. A panic attack is something different and really terrible. And so I think we do have to not pathologize every difficult emotion. There's this balance and this sense of seeing that everyone has certain experiences. It's when they become impairing and damaging and impossible to overcome that we need to really see them as disease problems. But at lower levels, they're part of the human experience. And so I think we need to get that balance in to
Yeah.
really get where we need to go, because we are in the US. We really have been, over my 20 years in this profession, we really have over identified and over pathologized part of the normal human experience. And I've heard it said, I think this is right, that we have people who are basically well, maybe utilizing too many mental health care resources, and people who are very, very sick, like the homeless schizophrenic person on the street, getting very little. And we need to really balance that. And that's part of the reason I say to go see a counselor, right? That there are very serious mental health conditions that are dangerous.
Mm-hmm.
Serious diseases like schizophrenia, bipolar disorder type 1, schizoaffective disorder, anorexia,
Yeah.
obsessive compulsive disorder, very serious issues that we need to use our mental health resources to discuss and treat those you know those very bad diseases, and not necessarily use up all our psychiatry appointments to talk about some of these normal feelings that we all experience.
Yeah, and I think maybe in our society we hear so much about like being happy, being present, doing breathing, doing yoga, but so we become, all of a sudden we feel sad and we think that something's wrong with us, when the
Absolutely.
truth of the matter is these are normal emotions that you have to go through to kind of learn different things, or it's just part of the makeup of the mind, and to not worry if you get sad because it's normal. It's just the part where you should be concerned is if you're staying there.
Correct. And I think that's maybe the next lesson, right? The things that are coming in mental health. Okay, number one, telehealth. I think across the board, and everybody's kind of talked about this, but I'm really seeing it firsthand that we're doing telehealth because in my state, medical professionals, if they meet directly in the office with a patient, they have to wear a mask. It covers all the way. I can't see their face, and I can't really assess how they're meaning their words, and they can't assess how I'm meaning my words, and we're sitting 6 feet apart and kind of yelling across at each other, right? So we're doing telehealth. And I think my patients are saying, man, this is more convenient. I'm not commuting across town. And even we're treating the whole state now, which is really neat. Texas is a big state. So we've got people who are, a 5-hour trek by car. I mean, you can, from San Antonio, I can drive 8 hours in any direction and not be out of the state. Okay. And so there are people all around our state here who I can provide services to. And they're saying, oh my goodness, this is so much more convenient.
Uh-huh.
And I think I'll keep doing it this way. So I think that's here to stay.
Okay.
And then the next thing that's here to stay is this conversation we're having about differentiating between, managing your state of wellness and really interpreting things as disease. I think we've got to get further along, and it's coming, where I can say to you, yeah, I do think you should take better care of yourself. It sounds like you've been run down, but I don't have to slap you with a label for some mental health disease, or leave you believing that there's something wrong with you because you're having a bad day or a bad
Yeah.
week.
And so what percentage of mental health do you think is hereditary versus
And so,
trauma?
yeah, so there's so much information on that even for the most highly hereditary mental health conditions, which appear to be schizophrenia and bipolar disorder type 1,
Okay.
even for the most hereditary, right? It's only about 40% genetics, and the rest is environment. And if you look at the data on depression, right? So we go in, and I'll fuss about my profession for a minute. We go in and we assess people. Oh, what's that family history? Oh, their mom had depression. It's, what medications work for the mom? Oh, they've got a strong history of all of this. But if you look at the data, the number one predictor of having any mental health condition in adulthood is childhood trauma. And we don't talk enough about that. Trauma causes mental health risk to open up and unfold in a person's life. And so, whereas you might get one person who was at risk for an anxiety disorder, but their life was very stable, they developed the tools they needed, they were safe, they were loved, and you take another person who's at risk for anxiety and they're in foster care, and they're abused and they're neglected, those outcomes are going to be incredibly different. And we really need, so my community here has a study on what's called ACEs scores, the Adverse Child Experiences Scale scores. And the Adverse Child Experiences Scale is a 10-item questionnaire that includes questions like, when you were a child before 18, was any member of your household incarcerated? When you were a child before age 18, were you ever afraid for your safety? Did you ever feel like you were unloved? Okay. And this 10-item questionnaire predicts whether or not you're going to have an adult mental health diagnosis better than just about anything else. And that is groundbreaking. Now, we know this. Like, this is another one of those things that I learned in my education and then said my mind is blown because we're not practicing that way. We're focusing on biology when we really ought to be focusing on prevention. You
Yes.
know, how do we keep kids safe so that they're not having those adverse experiences, so that we can upstream prevent having serious problems later?
Yeah, and I think that would be such an important thing that they should really start and kind of push and open that conversation of proper parenting, because
Right,
that's where so much stuff happens. But the thing is with parents, like, you don't know how to be a parent until all of a sudden you're a parent. So it's
right,
maybe having more education. But I like the fact that as mental health is being brought to the forefront, and as the stigmas are being stripped down and more people are talking about it and they're not ashamed, that and they're going to see mental health and people, and they are talking about these childhood experiences, maybe hopefully we'll see a difference in future generations, because they're thinking, oh my gosh, I need to be careful the conversations and how I make my child feel, because that will affect their adult life. And it's kind of like, if we could have a parenting education course of, you're going to get
right.
upset with your kid, you're going to do this, but how to kind of.
And if you look over the last, generation, from my parents to me as a parent, that really is happening. I do wish it could be faster, but over time, what happens with a lot of trauma is it's passed down, right? That
Yeah.
the parents, smack the kids around, and then those children grow up, become parents, smack their kids around, whatever, and contribute to trauma or neglect or all kinds of things. But more and more, I think people are saying, is what I'm doing healthy for the development of my kids? Are they growing over time into healthy people? And so I do think that's changed over time, where instead of, just control the child in the moment, we're saying, okay, how do I get the child to behave in the moment, but also make sure that what I'm doing is really healthy for them over time?
Right. No, that makes complete sense. And so we do have to wrap up, but I want to kind of end with this part of what more do you think could be done to help reduce the stigma around mental health?
Yeah, so that's a great question, and it's a little paradoxical. It goes back to something I said earlier, which is, we really have to talk about the difference between something serious and something normal.
Uh-huh.
I think we inadvertently, if you have a normal anxiety experience and you and I together agree that that's, a panic attack, then we deflate the importance and the seriousness and the severity of the true panic attack for the person who suffers from that awful, awful experience. And so what we can do is really take an even closer, more honest look at normal experiences, and then stress related experiences, which are bigger,
Yep.
and lasting experiences, which are even bigger, and crisis experiences, which are just awful, and rather than lumping them all together. I think that's got to be the next step in order for us to be compassionate and kind to the people who are suffering with the more serious problems.
Right. No, it's so true. And, this field has definitely come a long ways, which is amazing. And I think what you're doing a walk-in clinic is just amazing, because so many people don't have access to it, and you're really doing something amazing by providing these people who are so desperate for help, especially now. So thank you for doing that. That's amazing.
Thank you. Thank you. And we are, we're doing telehealth walk-ins too. So people can get on their smartphone and do a walk-in appointment, right away, which is really neat.
So where can people find you to find more information or contact you or?
Sure. So my clinic is called Sigma Mental Health Urgent Care. Sigma, SIGMA,
Okay.
Mental Health Urgent Care. And we have a website, which is www.sigmamhuc for mentalhealthurgentcare.com. And so that's a great place to kind of learn more about what we do and reach out if people are in need and so forth.
Okay, that's amazing. So yeah, if you guys want to find more information, obviously if you go to our website, we'll have all the links to contact her and to ask any questions that you might have. And again, if you're struggling, really kind of try to identify, if it's just a normal sadness or if something more needs to be addressed. But yes, healthy lifestyle, building up your immune system, reaching out to people. We're in such an isolation period right now that it is important to stay connected, even if it's through a computer or through a telephone. So yeah, with that being said, I want to thank my guest, Dr. Deuter. Thank you so much for taking the time to kind of break down these different things about mental health and some questions that a lot of people have, and when they should see a psychiatrist and when they should take medication or just see a therapist. So this has been amazing. And you guys at home, thank you so much for listening to another episode of Next to Madison. And we'll see you guys next time to find out who's next.
Hey, your host here, Madison Malloy. Please make sure to subscribe to the show on all podcast platforms, and please rate and review us on iTunes and Spotify. Also, if you have any questions or comments, you can email us at contact@nexttomadison.com. I thank you again for listening. Bye.